We are not. Yeah, there we are. We are live. This is episode 66 of Bono Stuff. Got a little Lincoln Park as per special request from Dr. Corey Hoffner here. How are you, sir? You're over there in Connecticut?
Yes, sir. Yeah, thank you. I appreciate the song choice too. I haven't heard that song in a while, honestly. It brings me back to high school a little bit. But yeah, I'm
Yeah,
located in
yeah.
Connecticut. Yep.
Sorry, dog is playing ball behind me there. Those watching on video, you can see me throwing random balls. Yeah, how's the weather? What's going on in Connecticut? Anything exciting going on today?
Not much, man. I mean, cold, very cold. It just
Getting there,
turned
huh?
like 50 degrees the other day. So it's we're getting ready for that winter, which we know is coming.
Yeah, I mean, I'm not going to talk about my Colorado waking up here. There's frost on the ground. It's like 31 in the morning, but now the sun's out, and since we're so close to the sun, it feels like 87. And sitting here in the window, it's just nice and toasty. But anyway,
Mhm.
let's circle back to we connected through Facebook. Yes, I believe.
Yes, yeah, we did. We met on Facebook.
Yeah, and so for all the bad that Facebook does, there is some positive in the world and some positive in that social media landscape. And it sounds like we do a lot of the same stuff in trying to disrupt this current broken healthcare model. I think anyone listening here is going to agree with these concepts of the current system looks like the sick care system or the symptom care system. So I'd love to dive into you're 4 years out of school. What brought you into that world? How did we get there? And just let you run with that.
Yeah, yeah, no, I always love answering this question to kind of start off, just to paint a little bit of background information. Obviously, I did my undergrad in exercise science or kinesiology, as the medical term, so to speak. And really, like, I enjoyed doing that. But when you graduate with that degree, you don't have like a set job you can get afterwards, right? Most people become a personal trainer. Some people go into like nursing. Some people go to grad school. You can go off into many different ventures. I actually got an internship my junior to senior year while I was in that program at University of Connecticut, and I worked with Division I athletes playing hockey and basketball. Those are the two main sports. And what I realized there is I really like to help people kind of rehab and get back onto the field, or the basketball court, right, or the hockey rink. Creating rehab programs with the athletic training staff. Usually people get hurt and that drives them into physical therapy. When I was on the opposite end of the spectrum, where I just helped kind of create those programs for them to kind of get them back on their feet and, help modify certain exercises for them when they shouldn't be doing like all the things the other team, the whole rest of the team was doing, so to speak. After that, I was like, I need to go to grad school, but I took off 2 years between undergrad and going to grad school, where I worked as a personal trainer in a gym because I knew I loved the human body. I wanted to work around the human body and I wanted to help people kind of achieve their goals because that's what made me happy. And seeing them hit their goals also made me kind of give me that sense of fulfillment, so to speak. And while I was personal training, I was like, I can't really help these people who are getting hurt outside of personal training just because I don't know how to modify things. I don't know like enough anatomy about the human body, even though I just went to 4 years of undergrad. I needed more in-depth knowledge to kind of take that next step. And that's why I decided to become a physical therapist and try and help those people pretty much like progress or like regress in certain exercises and hit that next level, whether they were athletes, right? Whether they were just an average gym goer, average Joe, so to speak, or if they were like someone who just worked out occasionally or wanted to play with their kids again, right? Fast forward and 4 years of grad school, worked 3 to 4 years in an outpatient clinic. Hated the healthcare system, right? It was burning out, so to speak. And I'm sure you got the same thing. Seeing 20 to 30 people a day, not being able to treat people the way that they deserve to be treated. And that's usually why they weren't getting better, so to speak, right? Because I see them for 5 to 10 minutes, pass them off to an aide who has little education. And then, finally hit me actually a couple months ago. And I was like, why don't I just open my own business and start doing virtual PT with people? Because during COVID, we were doing the same thing and I was having good outcomes with that. And that people were being more compliant. People enjoyed it more. They didn't have excuses to kind of miss on certain kind of every time we meet, right? We meet weekly, sometimes bi-weekly. Things just tended to flow a little bit better and I was in more control of my patients. And I can treat them the way I wanted to and not have to kind of call insurance companies, right, to try and kind of get them to extend people's plan of cares, the whole ordeal. That was pretty long. So, yeah, that's pretty much it.
Yeah, it's okay, man. I appreciate it. And again, it does sound like we had somewhat similar journeys of going from point A to point Z.
Mm.
But I specifically, and if you can hear my dog in the back, sorry about that.
That's all right.
I specifically wanted to, or dive a little deeper, just specifically on the question of, you found CrossFit, yes, and
Mhm.
you're kind of focusing on that and moving into this cash-based model. We can go for hours about everything wrong with the insurance model, but yeah, you did want to talk about that. So maybe you can break down for my dog and for the folks at home. She doesn't like the insurance model either. A little bit of what that insurance model currently looks like, and then how do you get people to go from, oh, I have insurance, and again, you're paying for insurance, which is why a lot of people want to use that insurance because it's
Mhm.
provided by their employer. But how do you go from that to saying, hey, pay me this much for my time in that hour, and I'm going to do a lot more for you in that hour? So how have you found that struggle? Because it is a struggle to convince folks of that. So going from that traditional insurance model to this cash-based model. Love to hear
Yeah,
about
great question. I'll be honest, a lot of people that I see are people who went to physical therapy, went in the insurance-based model, and just didn't have a good experience, right? They went into a busy clinic. Like I said, they saw the therapist maybe 5 or 10 minutes a session if they're lucky. Sometimes the therapist didn't even like work on them manually. And then they get pushed off to an aide who has little education, right? Maybe they're in high school, maybe they're an undergraduate and they're an exercise science major, and they're just not helping them a lot. And sometimes like they don't know the proper form or technique, and people get hurt. But with the insurance model, right? Obviously, you have a copay typically, and that can range anywhere from like I'd say 15 to 100 or sometimes $150. It really depends, and people get really pissed if they're paying over $100 each time they go, and they're not getting that time of the day with the therapist. And that's kind of where I've seen a lot of people kind of make that shift from insurance to cash-based program. And the benefits of the cash-based program, and obviously that's what I do right now, is it's more one-to-one, right? You get more accountability. There's more compliance from the actual patient because you're getting more one-to-one time with the therapist. And therapists tend to take more of a holistic approach. You're not restricted to just kind of doing what you're taught in school, right? Like I look at sleep, right? I look at hydration, I look at exercise, I look at diet. All those things play a role in your pain levels too. So they're all so important. But I think a lot of the population has no idea that the so-called concierge service or concierge PT actually exists, right? So it's just a matter of educating people. And I think if they know about it, you're going to see results typically in about half the time that you would if you were to go to like an average PT clinic that's super busy, seeing 20 to 30 people a day. I don't know how deep you want me to go into it, or if that's
That's all right. Yeah, no, we'll jump around as much as we need, and I know you have a time restriction as well, so we'll keep an eye on that. But it's funny you brought that up because I've recently been joking that I've been seeing a few folks, and similar to your point of, they've already seen a few clinicians. So I always speak about how I'm like the 10th guy. Sometimes they've gone to, especially with these CrossFitters that we can dive a little bit into the CrossFit world a little bit of, you have a little pain with squatting in your knee. So your coach, your CrossFit coach tells you, hey, maybe just don't go as low, or try these lifters, or put something under your heels, or, there's all these different small modifications. Try this one stretch, try this. And, maybe 5 times out of 10, it actually helps. But the other 5, then they go to that next chiropractor, and the chiropractor doesn't really help. They go to the physical therapist, and what's again big thing, and for me in physical therapy, I'm sure we can again go down some dark rabbit holes on this of underloading. And one of the things we're talking about that I tell people when it comes to how to choose a physical therapist, outside of the fact that cash base is probably going to be a better investment for you in the long term. But I tell people, if you don't have a squat rack and a barbell in that physical therapy clinic, then there's some money being left on that table. And again, for most folks, especially someone like a CrossFitter, if that person can't speak that language, and again, the traditional models, oh, CrossFit, they've put me through school, or they're putting my kids through school, so many injuries in CrossFit. There's a disconnect between the culture, between the science, and between the humanity of all that. So, but the joke that I was kind of leading towards that I've seen recently is the fact that I'm almost getting people better too fast because of this one-on-one approach, because, you kind of said, and I would say, yeah, conservatively, most cash-based PTs are probably getting people better in at least half the time. That's a pretty conservative and easy estimate and claim to make. Again, I just had somebody with back pain, first time she's ever had back pain, Navy, officer, 36 years old, never gone to see a physio, chiro, anything like that. Just woke up with some pretty bad back pain, and I got her better in one session. So it's a bad business model for us. But again, if I can get her, to refer other people to me and things like that, that becomes the business model. So again, we were going off the insurance thing, so I apologize to the listener if we went too far from the insurance based model, but I think you did a good job of summing that up. But one of the other bits to that is, and another weakness in the current insurance model, is the follow up, is the concept of like virtual PT that you and I both kind of practice, right? And we talked about a little in our previous call. So tell us a little bit about that. You want to talk about the emergence of virtual physical therapy, especially with the COVID pandemic, and that became a limitation. So how do you feel about virtual PT? How has your experience been? How have you found people to be kind of responding to that?
Yeah, so let me first start off with the negative component, right? Because there's a good part and a bad part to everything that you do, right? So virtual isn't for every single person. Depends, right? If you had a rotator cuff surgery or you had a total hip, total knee replacement, right, you should be going to a clinic in person because you need that therapist to kind of do some, manual joint mobilizations, excuse me, manual stretching. They need to physically work on it, maybe some soft tissue work to kind of reduce swelling. Especially if you're acute right out of surgery. You just need that hands-on care. But if you're someone who's just having like generalized low back pain, right? You woke up, like you said, your past patient, you woke up with low back pain. You're usually a perfect candidate for doing virtual PT. Or if you're someone who has like a really busy lifestyle, like maybe your kids go to multiple different schools, you're running around all day. It's a super kind of convenient thing for you to do because you're not going to be able to miss a session. You can even do it on the weekend. You can do it at night. Whether it's 30 or 60 minutes. Very simple to implement. And I started doing this actually in May of 2020 with my company because we closed the clinic for about 2 months because of COVID. It had just become so bad in Connecticut. People were too nervous to come out. People were just canceling right and left. So we're like, why don't we shift our model a little bit? And we use a system called Blue Jay, which is similar to like Zoom. You can actually measure joint range of motions and things like that using the system. It's just a HIPAA compliant system. And that tended to work really well. And I found like I was getting people better even quicker than when they came into the clinic. And that's what made me shift to kind of opening my own business. Right. You can see I'm rocking the shirt here, Hoffner PTSC. And I work solely, I'd say, with 80 to 90% of the CrossFit population, just because like I actually had a CrossFit patient. If I tell a little quick story, I treated him in the clinic when I was working about probably 2 years ago. And they had just offered to take me to a class. It was like free, bring a friend to class day or whatever to his local box, which is like near the clinic where I worked. And, I decided I loved it. It was just loved the community aspect of it and everyone working off each other's goals. Everyone wanted to be fit. No one kind of let anyone down or anything like that. Your neighbor would bring yourself back up if you couldn't do something, or they would help you with everything. But with that being said, I saw a lot of people doing things improperly, especially because it was such aggressive exercise, like a lot of Olympic lifting, like hang cleans, snatches, overhead squats, right? And a lot of times there was one or two coaches for like 30 people. And I was like, oh, something needs to change here. Like these people need more direction. They need more help because they're going to keep coming to see me in the clinic if I'm not helping them here kind of work on their issues. So right now I do one-to-one coaching with these clients, right? Like I said, mostly CrossFitters. I find them at local boxes, Facebook, social media. And really we do like a 12-week program where I work one-to-one with them. And again, we take a holistic approach looking at sleep, nutrition, hydration, stress, because all these things play an important role in their pain levels. And what we do a lot of is form correction and technique work. And I'm also a certified strength and conditioning coach. And that's something I've always taken pride in, is kind of breaking down movements so people can understand it and working on motor control around movements, right? Because that's so important, because a lot of people never learn how to exercise. And you show them how to do a pelvic tilt and they have no idea what the heck they're doing, right? And I'm sure you've seen it a million times. But they just don't get that hands-on in the clinic. And I think that's the big discrepancy and the big game changer.
Yeah, for sure. There's a lot there that we can go down, and I'd love to spend a few hours on each one of those topics. But as far as the virtual PT, I did want to wrap that up a little bit to make sure there was a bow on that. To say again, I do think it's emerging. I do think again with COVID, a lot of people try to shift to that. I've luckily, for my own sake and for my clients' sake, been doing that since I moved from New York to Dubai. I was helping people back in New York that I had that didn't want to kind of lose my ability to work with them and help them continue to improve. And then when I left Dubai back to the US, I was able to work with a bunch of people from Dubai, and I kept building that and really turning that into its own kind of part of my business. I'll also quickly shout out the fact that I have my 5 pillars of health, which sounds like kind of what you have going on, where I talk about movement, nutrition, and then the recovery components, which includes the sleep and breathing and things like that, and then the mindset and the connectivity to the pieces, which is a little bit to your accountability concept. So there's many ways, and I've spoken to many practitioners, including on this podcast. Stephen Horney, he's a New York City based physio who has his 8 pillars of foundations of health. My buddy Richard Simister, who just moved to Connecticut, actually from Brooklyn. He's keeping his practice in Brooklyn, but he's moving to Connecticut, so he's your neighbor now. He has his own 4 kind of pillars and things like that. So yeah, I've seen a lot of different versions of that. So I do want to again say it's just awesome to see like-minded folks on that same page and just moving things in that direction. And I also, as a quick plug for another show I'm doing, a podcast I'm doing with a personal trainer from New York City, the Upper East Side, my buddy David Corona, no relation to coronavirus. He is, we're doing an episode called the show is called Demand Better. And so our first episode was Demand Better from your personal trainer. And we talked a little bit about strength and conditioning coaches and how that can be a better fit for a lot of folks in having a proper long-term vision rather than I just want to lose 10 pounds or I want a 6-pack for the summer. And then our next episode is actually Demand Better from your physical therapist. And we're going to touch on the cash versus insurance model. We're going to touch on where does virtual PT fit in, underloading. And then I did want to take that as a way to go to that third kind of concept. You talked about PT aftercare. Before I let you run with it, again, for myself, because of my background, similarly between that fitness space and the healthcare space, I speak with a lot of physical therapy clinics, and I kind of offer them, hey, like when your client is done with their ACL rehab, right, which is like you said, or a total hip replacement, how are they then transitioning back to life? If they've just met those kind of really basic, which I think we say basic, but obviously they're big accomplishments for somebody to properly rehab through their total knee replacement or ACL reconstruction. But then it's how do we get them to ski? How do we get them to return to sport or even optimize? And that concept of performance, which is the like buzzword where we need to throw it in there. So I guess I'll throw it back to you how do you integrate PT aftercare? Are you able to reach out to other physical therapy clinics? Is that something they're able to say, hey, this guy kind of understands that blend? And that's kind of my ideal. And I'd love to hear, again, how you've been able to integrate that.
Yeah. So what I actually do, because I used to be a personal trainer too, like I had mentioned for a couple of years before I kind of made the jump to go to grad school, my program actually, after 3 months, right, 12 weeks of working with a client, typically will transition from a physical therapy program to more of a personal training program, right? Sometimes it's a hybrid of PT and personal training. It depends on like what the client really needs. But that's super important because that's what I find even from working, the past 4 years is like after people, eliminate their pain, if they do a good job in therapy and they have a good therapist supporting them, they don't know what to do afterwards, right? That's the big kind of thing where they're kind of confused. Sometimes they get a program with like 3 exercises on it and the PT is like, okay, go off. You're good to go. You're good for life, right? Maybe they'll do those for a month. Then they stop exercising completely. Boom, they revert back to kind of day one, right? Where they have the same issues, if not worse, or other issues develop on the other side of the body. It just kind of escalates that whole kind of pain funnel all over again. So I'm actually working on programs right now to transition people who finish PT. Most commonly with the CrossFitters I treat, it's shoulder, back, and knee pain. So we're working on like creating like programs around what I do with a lot of my clients who shift from PT to personal training. And because a lot of them do the same things I'm finding over and over, or need the same things in terms of exercise and progressions, that I can just make a program for them and give them that so they can carry on and progress with that moving forward. I think a lot of people get into like subscription programs or some classes too, which is a great alternative. Even CrossFit, because it gives them that community aspect. But again, it depends on the client. It's individual, and that's like the answer you're always going to get, which is not a great answer. But it's important one to take into account.
So trying to synthesize all this, I love all
Mhm.
the answers. And again, we're so on the same page. So I'm going to kind of selfishly put you on the spot. Hope
Mhm.
you're okay with that. And hope that you can come up with some answers that I can then steal later on. Of here's the first question, rapid fire, or putting you on the spot is, how do you define yourself if you're in a elevator, or let's say you're sitting on an airplane next to someone? Hey, I'm Corey, and I do blank. How do you define yourself?
Yeah, so my blanket statement, so to speak, right? So
Elevator pitch, or what have you.
yeah, yeah. So I mean, I would say, I mean, mainly, right? Obviously, I'm a caring and passionate physical therapist who really tends to help CrossFitters, anyone between that 30 to 60 age range, male and females, eliminate knee, back, shoulder pain, right? So they can kind of get back to their workouts without having medications, injections, or surgery. That's the big component, because a lot of people don't understand. Like, even if they have a $20 copay, they're going to PT for 3 months. They could be spending thousands of dollars.
Right.
If they need surgery, that's going to be, quadruple that amount, if not more. Like an average like rotator cuff or surgery or knee replacements, like 50 to 100 grand. It's absolutely insane.
Right.
Whereas if you hire a cash-based therapist, you could spend maybe 1 to 2 grand, and you could eliminate having any of those issues and learn how to properly exercise, because someone's
Hmm.
going to put more time and effort into you.
Gotcha.
Yeah.
So yeah, again, I'd love to pick apart all that, but I'm going to try to simplify it and bring it back to, if somebody asks you what is physical therapy, let's
Mm,
go to that. So as a profession, not just what you do, and again, that's kind of preparation for my Demand Better from Your Physical Therapist podcast that I'm about to shoot later this week. So I'd love, again, for your 2 cents and kind of your experience around and being a relatively new grad. We're going to call you. Oh, you're 4 years out.
mm.
Um, I feel like an old timer. I graduated in '08, so we're coming up on 13 years. So, but yeah, tell me a little bit about, how would you define physical therapy to that person again on the airplane, or if they happen to ask you what is physical therapy?
Yeah, so I would say, physical therapy is definitely a field that involves someone who knows, the most they can about the human body and how it moves, and how it acts, right, and how posture kind of affects us overall, right. I would say like physical therapists are movement specialists, and that like we're good at depicting like what the joints are doing with certain motions, and what it means to be in faulty postures for too long, and how to correct those, and how they play a role in our lives.
Yeah, no, it's a really good answer. My attempt at simplifying that is just calling us musculoskeletal experts.
Yeah.
And again, I've seen a little bit adding like neuromusculoskeletal experts, and then it gets a little more dicey and things like that. And but the other part too for me, that I'm gonna take this opportunity to dive down the path now of, in terms of the profession from a global view. When I would speak at my high school's career day, I'd go back and talk about physical therapy and what is it. And it's not just, oh, you have an injury and you can fix yourself that way. If, like you kind of said earlier, a lot of folks do find it that way through playing sports. And that's how I kind of stumbled upon it, sort of, was I sprained my ankle in my senior year of high school pretty badly. Our team doctor at the time was a chiropractor. So I went in with my really, really bad ankle sprain, and he cracked my back, which I was like, I need to figure this out. This is cool. And then realized, like, yeah, it's not really much science behind that. But not to talk too negatively about, first of all, Dr. Dreyfus, if you happen to be listening, I know he's still out there cracking backs and fixing people and making them feel better, and not just by that, but shout him out. But on top of that, the thing I speak about a career day is the fact that, just like the medical field, physical therapy is an allied health profession, which has, I don't know if it's 20 underneath like specialties at this point, including women's health, pediatrics, geriatrics, sports, orthopedics, neurology, et cetera, et cetera. So I think it's important to have that kind of big global perspective when we talk about physical therapy. That again, when we get caught up in our, talking to CrossFitters or triathletes, or I'm putting these ski and snowboarding programs together here for the season here in Colorado, that I'm excited about. And again, it's a different conversation, right? And again, I've actually tried to move away from the concept of physical therapy, which it sounds like you have as well, because what do most people associate with physical therapy is either I'm only going to deal with you if I have a surgery, a major surgery, total hip replacement, ACL reconstruction. And then the other kind of common standard way people think about or have experienced physical therapy is it's hot packs, electrical stimulation, ultrasound, maybe a little bit of stretching or massage. And unfortunately, that's what also gets put out there in the media. So all that to say, again, I do think it's awesome that, again, there's guys like you out here, hopefully changing that perception, that mindset, and bringing it back to that simple, we are musculoskeletal experts. So if you have an ankle sprain, you should see us. If you have some backaches, you should see us first. And so I wanted to ask about your Facebook group. And if anybody's interested here, we'll try to have a link somewhere, or they can just reach out to me. I'll connect you to Dr. Hoffner and Never Quit CrossFit, which I think is a great concept. And tell us a little bit about the group and what your aims are for that, and a little bit, in that regard.
Yeah. So, the group is for CrossFitters, right? You don't have to be dealing with an injury, right? We have people in there who aren't suffering from an injury or anything. They're just people who, usually two things, right? They want to get better at pull-ups, I'm finding, and they want to get better at overhead squats. Like those are the two main things I'm finding from like thousands of CrossFitters that they have issues with. A lot of them have issues with like muscle ups, hang cleans, snatches, etc. But this is like an area where they can kind of just talk amongst each other. We list out questions throughout the week. Do you have issues with kipping pull-ups? Like maybe I can help you. Do you have issues with overhead mobility? I'm going to give you some tips and cues, some exercises to do. This month, we're doing a 4-block series on how to achieve the perfect pull-up. Right. Next month, we'll do a series on how to achieve the perfect overhead squat, where I break it down into like mobility, shoulder and thoracic first, right? Strengthening second. Number 3 is like how to progress those exercises to go from like horizontal rowing, right, to more vertical inclined exercise, and then more function specific exercise. But really, there's lives every Tuesday. So what I wanted to do is create an environment where CrossFitters can talk amongst each other, educate them in the process, but also I can help them too. And I do free movement screens throughout the week too, where I'm posting in the group, and we do them over Zoom. And sometimes I'm telling people like all these things about their posture or their body that they just never have heard, right? Because maybe they went to the doctor, saw their primary care, he did a couple tests, maybe he like palpated a couple spots, but they really don't know. And I think that's getting big in that, like, we can have people start coming in for like posture screens, like every quarter or like once or twice a year, because it's almost as important as getting a physical. Right. It's something that never gets addressed that I think should be important, and it might hopefully get integrated into society in the next coming years and everything, especially with virtual becoming more and more of a thing.
Yeah, I mean, I think the APTA did at some point even discuss that back when I was back in the day when I was a student of pushing annual orthopedic checkup, just like the dental profession says you should see your dentist twice a year just to get that checkup. And I think the problem, even though we are, again, the musculoskeletal experts, to the extent that slowly I've seen over these last 15 years or so, more physical therapists in emergency rooms, where if you show up in an emergency room with a musculoskeletal condition that might not need an x-ray, that might not need an MRI, where again, if you're just seeing a general ER doctor, they're going to say, hey, go get an x-ray. Let's make sure this is going on. Versus I think you and I, with our backgrounds and other physical therapists who specialize in emergency medicine, can do some basic tests with our hands, with our eyes, that tells us, hey, you don't need an MRI right now. Like, we're going to save however many thousands of dollars in tests. And all you need to do is try this for now, either try these exercises and again, hold off on opioids. Let's not go down that rabbit hole. So again, I do think this is a solution, and I definitely advocate for an annual orthopedic checkup. And the problem there, again, is as a profession, I think we cannot agree on what should that entail. So even dentists, it's pretty straightforward. Like, you're checking for cavities, you're checking for, bleeding gums or whatever. There's X amount of things you can look for, but there's so many different ways we can assess it. Again, I'd be curious. I think I've heard you mention that you're part of your assessment includes FMS type situations or moves. And again, I do play a little bit off of that SFMA, which is the medicalized version of the FMS. I don't know if you played with that a bit or incorporated, but yeah, the combination of all that. And again, it sounds like you and I would have a lot of overlap, but as a profession, unfortunately, we haven't gotten together as the American Physical Therapy Association and said, hey, let's really push this thing of annual orthopedic checkups, the way the dental profession did so long ago. And people just kind of know that, not that 100% of people go to their dentist all the time, but people still know that, just like chiropractors, people associate with back pain. They did a really good job of the marketing. We kind of, suck as a profession on the marketing front. And again, we're part of that medical system. We're kind of like, you have your surgery, you have your physical therapy to recover. And outside of that, we aren't cutthroat the way a lot of these other professions are. Anyway, without talking about all the negative there, can you share a little bit of your assessment? Do you mind sharing a little bit of that? Just kind of the philosophy behind it. What are you looking for? You mentioned postural assessment. Again, if you can share anything there, that I'd appreciate. I think the listeners would love that too.
Yeah, so the functional movement screen, right? I'm not using that for everyone, but if you're an athlete or if you're someone coming from CrossFit, you're going to really benefit from doing the functional movement screen. And it's very simple, right? 7 strict movements. I'm not going to go through them all because we'd be here for a while. But we're looking at things like single limb balance, right? Your ability to kind of bring your knee up, kind of come over like a little bit of a height, and make sure your hips, we're looking at your hips, like pelvic symmetry, looking at hamstring length. During my movement screens, like I'll be honest, like a lot of times over Zoom, I don't have time to do those types of things and people don't have the time for me to take them through that. But if I'm in person, it might be a little bit different. I'm doing more of like, I'm looking from head to toe. I'm looking at their feet first, like looking for if their feet are over pronated, meaning if they're flat footed, right? Or if they're supinated, meaning they put more weight towards that pinky toe. Then we work our way up the chain, right? I'm not obviously able to palpate being on virtual, but I'm looking at kind of where their pelvis sits, right? We're looking at where their shoulder blades sit, scapula. I'm having them do like an overhead reach, right? Almost like a snow angel up to the side. And I'm finding a lot of people do the same exact things, right? A lot of people arch at their lower back. People who have back pain, especially, they have that excessive tilt forward of their pelvis. Obviously we can't test strength either. So I'm doing some functional tests. Like I'm looking at a squat, sometimes a lunge, could be an overhead squat. Sometimes it could be a pull-up. That's really kind of the simplicity of it. I like to use the KISS principle where I keep it simple, stupid, so to speak, right? Just so people aren't getting overwhelmed in the 10 to 15 minute screen that I'm doing. And then from there, if they want to dive deeper into it, I offer them another one where they can pay me obviously for coaching and whatnot. And we'll dive a little bit deeper. We can do some more like special tests and things like that, depending on their pain levels and things like that.
Gotcha.
But that's kind of the short and kind of dirty version of it.
Yeah, man. Perfect. I love it. I mean, just to kind of, I think we talked about a little bit for the listener. Again, I have a 21-point virtual screen, similar concept that I've developed over my career of again, just trying to load as much as possible. I've stolen from the best of folks in the industry, including I'll shout out Chris Johnson, who has a pretty basic runner screen. He's big in the triathlon community, and just 4 real easy tests that if you can't do these 4 things, you shouldn't be running. Just like CrossFit, there's a lot of little things where we can either say, hey, you shouldn't be overhead squatting. You have pain when you squat. How do we actually address that? Which is why a lot of those times, like I was talking about earlier, 5 out of 10 people, maybe some of those basic things will fix that, which is great. But then those other 5 kind of get lost in the shuffle and continue on with their pain until eventually they need surgery or eventually they have bigger issues. So that's where I like to step in and say, let's address the actual underlying cause, which sounds like, again, what you're kind of looking for.
Yeah, not to interrupt you or anything, but I mean, to branch off of the SFMA or FMS, right? I actually kind of create my own exercises. SFMA has breakdowns, right? If you can't do something, it gives you like, do this exercise, then this, right? And I do something similar where I have like set plans and set routines where people will do those certain strict things. And that's because that's what I found like works for most people who have that issue of like, too forward of a pelvis, like during squatting, right? Too much of an arch in the back, et cetera.
Yeah. Perfect, man. Well, again, I know we're coming up on time. Want to be respectful of your next appointment and your next patient. So tell folks where best places are to find you.
Yeah, perfect. So you can find me on Facebook at Corey Hoffner. Okay. Or you can find me in Never Quit CrossFit. That's the name of the Facebook group where we have lives every Tuesday night. And then I'm slowly getting more and more into Instagram currently. And you can find me on Instagram at Dr. Hoffner, PTSC. which is really just the name of the company. And PTSD just stands for physical therapy, strength and conditioning.
Putting it all together.
Yes. And last place would be my website, which is www.choffnerptsc.com.
Gotcha, man. Well, really appreciate your time. We got an ad playing. I was going to play a little Linkin Park if it allows, but to wrap us out, and hopefully we don't get copywritten here. But yeah, man, really appreciate your time. You can stay on a little bit after we sign off here. A little numb in the back.
Thanks for having me.
But yeah, and this will be up, should be on all podcast platforms, all that good stuff. I look forward to our next chat, my friend, and everybody have a great day. And again, my dog is down there barking at other dogs. That we'll wrap it up on that ending.